Good morning or good afternoon. My name is Beth Bernstein. I serve in the South Carolina House of Representatives. I represent House District 78, which is right here in Richland County. And I'm accompanied here by Representative James Smith, who also is in Richland County, who's District 72. I think we can all agree that if we had a vaccine that would prevent cancer, we would all take it. We would have our children take it. Have our friends and family take it, and luckily there is such a vaccine, and that's why I'm proud to announce the introduction of House Bill 3402, the Cervical Cancer Prevention Act, a bipartisan effort. This is a companion bill to the Senate Bill 278, which was introduced earlier this month by Senator Brad Hutto. It's already gone through the subcommittee process, and it was overwhelmingly approved in subcommittee. We appreciate, since we're celebrating Cervical Cancer Awareness Month, we appreciate Governor Haley proclaiming this month as such. Cervical cancer is a critical public health issue. It claims an average of 5 lives per month in South Carolina. According to the Center for Disease Control, South Carolina ranks 14th in new cases of cervical cancer and 7th in cervical cancer deaths in the United States. These are deaths that could have been prevented. Let me say that again. These are deaths that could have been prevented. The HPV vaccine prevents 75% of cervical cancer cases, 70% of vaginal cancer cases, 50% of vulvar cancer cases, and numerous other types of cancer affecting both men and women. This vaccination can help keep our sons and daughters healthy, and it saves lives. 50% of the young women aged between ages 13 and 17 in South Carolina have not received the full HPV vaccine, and 80% of young men have failed to receive this important vaccine, which, let me emphasize again, which would protect them from preventable cancer. This bill was introduced by Representative Smith and me as a way to increase the knowledge of parents and young people about the importance of getting vaccinated. The main focus of this legislation is not only to increase access and awareness to the HPV vaccine, but to provide parents with the information on the link between HPV and cancer. It's not a mandate requiring a vaccine. It's providing information on how to obtain the vaccine. I urge swift action and a positive vote from the 3M committee. That's who's going to hear this bill. I'm encouraged that it's going to pass. It's time to work together. It's a bipartisan effort to put prevention first. This act sends a strong message that we value our children in South Carolina. We will stop at nothing to protect them today against the possibility of cancer in the future. It is important that all South Carolina families have knowledge and access to this life-saving prevention method. HPV vaccination today is cancer prevention for the future. I'd like to turn this over now to Lauren Whitesides, who will talk more about.
Hi everyone, my name is Lauren Whiteside and I am 31 years old. I was born and raised in Lexington, South Carolina, about 20 minutes from where we stand here today. I'm a graduate of the College of Charleston and now call Charleston my home away from home. I was always the person that went to all of my annual doctor appointments, including my annual gynecological wellness exam. I had abnormal pap tests before, but I was never too concerned because my provider said that the HPV would most likely clear on its own. Like most young women, the human papillomavirus was a term I was not too familiar with, until I was told in 2010 that I had a high-grade version of HPV, a type that could potentially lead to cervical cancer. I was a healthy young woman, and my provider suggested continuing with 3 to 6 month follow-up appointments that consisted of more pap tests, colposcopies, and biopsies. Then, in 2010, for the first time, the word cervical dysplasia and HPV became scary. For me, things had just become real. I had my first surgical procedure to remove the abnormalities, and then 6 months later, I underwent a second surgery to remove a cone biopsy of my cervix. Waiting for those lab results was the longest week of my life. Everything I could possibly think of went through my mind. Do I have cancer? Will I be able to have children? Will people judge me? I was beyond lucky. The precancerous lesions had not spread any further. I have been clear of any dysplasia for a few years now, but every year when I go in for my annual appointment, the anxiety starts to build again. After what I went through, I immediately started to research information online and came across the National Cervical Cancer Coalition. This is where I was able to find accurate educational information on their website about cervical cancer and HPV, and read the countless stories of women who are just like me, women who have HPV, women who are frightened and scared, women who are battling cervical cancer. I immediately knew that I needed to do something to help so that no woman had to go through what I did alone, and without the support of educational information and individuals who knew firsthand what I was facing. I reached out to the National Cervical Cancer Coalition, and on January 31st, 2011, the South Carolina chapter was officially established. That is where my journey began. I aim to help spread awareness on cervical cancer and the HPV vaccine. Our chapter has partnered with other nonprofit organizations such as the Cervical Cancer Free South Carolina to continue the growing cervical cancer free movement. Cervical cancer is preventable, and our challenge is not only to make people aware of life-saving tools like the vaccine, but encouraging the community to have conversations with providers about cervical cancer prevention. Facilitating these two-way conversations among patients and their providers is a great way for educational outreach. Parents and guardians deserve accurate, easy to understand information about a recommended life-saving adolescent cancer vaccine that will help them make healthy and responsible decisions for their children. The Cervical Cancer Prevention Act is critical. It sends a strong message that we value our children and want to provide them with a future without the threat of cervical cancer. On average, 5 women die of cervical cancer in South Carolina each month. These women are your neighbors, your co-workers, your friends, your partners, your wives, and your sisters. I stand here before you for all of the women that have battled HPV, for all of the women that are cervical cancer survivors, for all of the women that have lost their lives to this disease, and for all of the family members and friends of these women. Women do not have to lose their lives to cervical cancer. The Cervical Cancer Prevention Act is a straightforward bill that helps parents and guardians make informed decisions, which will result in increased awareness about the vaccine and its ability to prevent cancer. The Cervical Cancer Prevention Act and HPV vaccination is cancer prevention for the future. Please make a stand in support of this life-saving bill. My hope is that cervical cancer will be eradicated. Please join me in making this hope a reality by breaking the silence. It's time to put prevention first and support the Cervical Cancer Prevention Act.
My name is Robert Reigart. I am presently president of the South Carolina chapter of the American Academy of Pediatrics. I am here today to support this cervical cancer prevention vaccine. I'd like to talk a little bit about HPV and the vaccine. It's important to recognize that this vaccine is part of routine pediatric care. The CDC recommends providing the vaccine to girls and boys who are 11 to 12 years old. It is given with other routine immunizations at that age. These other vaccines are the Tdap, the meningococcal vaccine, and the annual influenza vaccine. At the present time, all of the other preventive adolescent vaccines near in South Carolina are near the Healthy People 2020 goal of 80% of children immunized. However, only about 60% of adolescent girls in South Carolina are presently receiving even the first dose of this vaccine. The vaccine is given in 3-dose series. Boys are receiving it at an even lower rate. This time, approximately 30% of boys receive their first dose. The American Academy of Pediatrics and the South Carolina chapter of the American Academy of Pediatrics consider increasing the rates of uptake of this vaccine as a high priority. And departing from my prepared remarks, I have to say that it's frustrating that this vaccine has not been accepted by everyone as a routine part of the vaccine series. And having to have legislation to promote it is really, frankly, frustrating to me as a pediatrician. I accept it, and all members of my chapter consider this something that every adolescent should do. And we present it to our patients in that way. We say, this is just part of what you're going to get today. You're going to get your HPV, you can get your meningococcal vaccine, and you're going to get your Tdap. Again, it's important to recognize, as already been said, the HPV vaccine is a cancer prevention vaccine. It is, as I mentioned, strongly recommended to be routinely administered to 11 to 12-year-olds. This recommendation comes from the American Academy of Pediatrics, the American Academy of Family Medicine, and is also based on a specific recommendation from the Advisory Committee on Immunization Practices at the CDC. The CDC has stated that almost all cervical cancer is caused by HPV, and that it's the second leading cause of cancer deaths in women. The estimate, if we can reach our immunization goals, it will prevent somewhere on the order of 70 to 80% of all cases of cervical cancer. And I should mention at this point that we are near having a vaccine which covers 7 strains of HPV. The old one was either 4 or 2 strains, depending on which you use. So we may have even a higher level of protection with this new vaccine. You've already heard that HPV is strongly linked to cancers other than cervical cancer in both men and women. HPV is the most commonly sexually transmitted virus in the U.S. More than half of all individuals are infected with HPV at some time in their lives. The strategy of immunizing young adolescents is similar to our strategy for all the other pandemic vaccines. They would give the vaccine to people before they're exposed to the disease. It's very important. The vaccine does no good if you've already been exposed to the disease. So, for instance, with the current measles epidemic in California, we're behind the 8 ball when we start immunizing people after they've been exposed. And in fact, you might have noticed that there are parents in California who are afraid to send their children to school because they're susceptible children, and there may be cases, and their children may be exposed. So, people get into discussions about this vaccine, which really should be routine. But we want to remember that we need to give it to young men and women before they're exposed to the virus. And that's the reason we chose 11 to 12-year age. It is important, since it's not fully accepted as routine by everyone, at least by me, to have this legislation which provides education to promote the vaccine, particularly get our rates up to the 2020 healthy people of 80%. It also will help the approximately 2,400 children in South Carolina who fall in a gap in coverage. They don't have insurance, and they're not in Medicaid. They're between them, what we call underinsured. And so they can't get it without spending a lot of money on a family for a vaccine that's a 3-dose series and costs about $120 a dose. So one of the things that's in this bill is quite important is the ability to provide this vaccine to underinsured individuals. So this is good legislation. I should say I did testify on behalf of the Senate bill last week. And I was really happy to hear it come out of subcommittee with a very strong recommendation passage. And I'm confident and grateful that this House bill will have the same outcome, be passed, and benefit our children. Thank you very much.
Thank you, Dr. Rygards. Thank you so much for your work in this area over the years and your friendship and support. Lauren, thank you for your witness, very powerful witness which you have taken and turned into action for so many others. And it is my hope in working with my colleague, Representative Bernstein, and here standing on behalf of another dear friend and colleague, Representative Jenny Horn, who cannot be here, she's in court today. But she stands in a clear support of this bill to show its bipartisanship and the broad support that the House has for this, and that this year we're going to get this done with your support and your efforts. As cervical cancer rates continue to rise across the state, we need to look past traditional political labels in order to work together to control this health crisis. No woman should die from cervical cancer when we have the tools to prevent it. While it is clear that HPV infection and cervical cancer are critical public health issues here in South Carolina, some object to the HPV vaccine for political and ideological reasons. I'm here to say that politics should not get in the way of saving lives. This effort transcends political and party lines. It is only together that we can tackle this issue. It is time for South Carolina to take the necessary steps to increase public awareness and access to this important vaccine. The Cervical Cancer Prevention Act will allow parents to easily access information about HPV and the HPV vaccine so that by, again, working together, we can lower South Carolina's cervical cancer mortality rate. Parents and guardians deserve access to accurate and easy to understand information about a recommended life-saving cancer vaccine that will help them to make healthy and responsible decisions for their children. Understanding the full range of options will result in increased awareness about the vaccine and its ability to prevent cancer. HPV vaccine is here today and to prevent cancer in the future. This bill has come before our body in previous times, and we've come close. But I'm here to say, and I know Representative Bernstein joins me, that this is the year that we get this done. And we do this together. The words that Representative Bernstein and I may say on the floor really don't get bills passed. It is the work that all you all will do at the subcommittee level and at the full committee level and on the floor of the House helping to educate members, which will ultimately make us victorious. And we'll never forget what we're about. And we're about saving lives and supporting and improving healthcare options for women in our state. So thank you for being here, and we appreciate your support.